So fallopian tubes can become mildly or severely blocked due to mucus, scarring, or adhesions. This may be at either end of the fallopian tubes or potentially in the middle. And blocked fallopian tubes are actually responsible for 20% of cases of female infertility, and can also increase your risk of an ectopic pregnancy. And this is because the fallopian tube, once that's blocked, it prevents the fertilized egg from traveling to the uterus, and instead it actually implants in your fallopian tube or somewhere else in the abdominal cavity. So the question is, why does these fallopian tubes become blocked? And the reason is because these fallopian tubes are incredibly tiny and narrow. They measure 10 centimeters or 4 inches in length, and they're the width only of a regular strand of spaghetti. So inside this 10 centimeter long strand is a narrow passage, which is the size of a sewing needle. The mature egg needs to actually get through this tube and is roughly the size of a full stop that appears. And so it's so small that it can easily become blocked in this tube. The fallopian tube also contains mucus. So to slow down the passage of the egg, there is mucus in there, because it gives the endometrium more time to thicken to sustain the implantation and pregnancy before it comes down the fallopian tube, which is pretty incredible, I would say. But the problem here is that any mucus producing organ can also become blocked. You know, just think of your nose getting blocked. So this mucus, generally thin and serves a very good purpose, but sometimes it can actually become thick for certain situations. And these can include dehydration or your diet, if you're eating a lot of mucus producing foods, such as dairy. Or maybe you've got taking particular pharmaceutical drugs, and also coffee and alcohol, because these are diuretics, so they can make you dehydrated, and also smoking and infections. Other more serious reasons for blocked fallopian tubes is a traumatic vaginal birth or a C-section, endometriosis, and autoimmunity. So because some of these can lead to scarring and adhesions, and they can then pull and distort your fallopian tubes. And in these situations, they may need to be removed surgically with a laparoscopy. There is a procedure called hycosi, which is a hysterosalpingo-contrast sonography, where fluid is actually injected in through the cervix. And an ultrasound scan is used to see if the fallopian tubes are blocked. So this procedure can also be used to treat fallopian tubes when they actually get rinsed with saline solution. Now, natural treatment for blocked fallopian tubes include a few different things. So once the initial cause of the blocked fallopian tubes has been addressed and identified, it is actually medically applicable to treat blocked fallopian tubes naturally. And the natural fertility approach actually focuses on preventing recurrent infections by strengthening your immune system and minimizing scar formation. And we do this through adequate nutrition, improved circulation to the area through massage and pelvic floor exercises. And nutritional and herbal therapies can be beneficial in mild cases of scarring and blocked tubes, whereas actually the manual therapies have been shown to be even more beneficial for the more severely blocked tubes. So dietary recommendations for blocked fallopian tubes include avoiding mucus-producing foods such as dairy and soy. You want to avoid anything that you're allergic to, and these are commonly yeast, dairy, soy, wheat, eggs, and all other foods that you are individually allergic to, or which foods show up on a food intolerance chart. You want to avoid coffee and alcohol. You want to drink 2 litres of purified or filtered water every day. You could increase your intake of garlic to naturally prevent bacterial infections, and also increase things like cinnamon, ginger, cayenne. So increase these in your diet, because they'll actually improve blood flow to the uterus and could potentially break up any congested mucus. A combination of spirulina, chlorella or green tea can also help your body to remove the toxins and repair tissues. Lifestyle recommendations for blocked fallopian tubes include stop smoking if you are. You have acupuncture treatment, which helps move the energy, the blood and the mucus through your body, and that will help to clear any blockages. We recommend getting an abdominal massage or to use a self-massage video at home. We want you to exercise regularly to improve your circulation and also get your limbs moving. Doing yoga, very important, and to see a naturopath or herbalist to get suggested herbs prescribed professionally. And as we talked about before, castor oil packs can actually help to break up the scarring. So herbs and supplements that are beneficial for blocked fallopian tubes include omega-3 essential fatty acids, zinc, selenium, vitamin E, vitamin A, beta-carotene, magnesium, and silica, which all assist with inflammation, scar tissue remodeling, removing adhesions, and keeping the cilia in good shape. And there are also herbs that might be helpful for your individual situation, and this will depend on what your practitioner will recommend for you.